It's Talk Erie on the Joel Natale Show. We're live from our Kingdom Financial Group studio here. And once a month, we are getting a primer on things in the insurance industry, especially when it comes to Medicare Annual Enrollment. And we're just so excited to have Sadie and Emily with us here from Hilling-Pfeffer Insurance. And ladies, it's Medicare Annual Enrollment. It's the most wonderful time of the year, isn't it?
I don't know about that. It's definitely busy.
No, well, you get the this is what I love about what you have taught us. You're connecting with every single one of your clients and prospects right now, because everything changes every year in annual enrollment, right? I mean.
Not everything changes, but there's a big chance for change.
So you want to go over it. You want to have a chat.
Absolutely. Your health changes as you age. We all know. And so have your prescriptions changed in a year? Should we rediscuss what those look like on your plan, what tier they fall into, and what the cost is going to be, whether they play into the deductible, if they're deductible exempt. We are seeing a bit more of those this year.
Deductible exempt.
So
what does that mean?
So it doesn't. We are seeing more deductibles on the prescription side of it.
Okay.
Not to get too much into it because that is very carrier and then plan specific. But it would be your copay could play into that deductible, and there's a couple $100 is typically the deductible, and then it would come down to the lower cost sharing, and then potentially lower, depending upon what tier it lies on.
All right, so let's start, Sadie, with what should people be doing first? Should they be calling you or calling their agent, right? I mean, yeah.
They should be reaching out to their agent, whoever signed them up. If they don't have anybody, they're more than welcome to reach out to us at Hilling-Pfeffer in the Health Division. We'll gladly take them on, and then it's a free annual review. It doesn't cost them anything to speak to us. We can do everything over the telephone, or we can do it in person at our office. We also do, for those that are homebound, we also make the exception, and we'll travel to them with our laptops and make sure that they have the same type of care, if they're more comfortable with meeting with us and us coming to their homes. So we do that as well. So there's 3 ways to be able to meet with us, and we just set up the appointments and then make sure that we have their information. We actually have a really neat system that we send them out an email if they're able to do that, and they answer some questions for us, and then we have all the information we need, so we can actually get it done within half an hour, 45 minutes, with all of their information already in our system, to be able to make sure that their doctors are covered, their prescriptions, as Emily was mentioning, are covered, and what plans work best for that. So it's really just kind of going over everything that they can, that we can do for them, and making sure that they're on the same plan if their plan is still active, and going from there.
There's kind of 3 pillars that you have to look at when you're looking at Medicare, right? You have the original Medicare, you have the Medicare Advantage, and then the Medigap supplement. Help me out with these again, because I'm,
it's
still
a lot
wrestling.
of letters.
It's a lot of letters, yeah.
So you've got your original Medicare, which is your parts A and B, which is done through Social Security. You do need to have those set up before you come speak with us. However, we can help guide you in that process and giving you the correct links. If you're someone who's a little shy with that, we can send you the correct ones and the correct site.
I mean, you even have to set up the login if you haven't done it, which you should have already, though.
Correct.
Yeah,
And then if you are just a computer illiterate person or you just want some help, we can do that in office with you as well. We prefer if you bring your own computer or own phone, so we can set it up on that device. And that way we can save your password for you and username. But that covers about 80% of your overall insurance needs, that original Medicare. So what you want to talk to a Medicare agent about, a licensed Medicare agent, is that other 20%, which would be Part C or Advantage or Medigap/supplement. I swear they love to make multiple names for a few things. An Advantage plan is most comparable to employer coverage, what you had while you were working potentially. It includes prescription coverage, dental, hearing, vision. And then the Medigap or supplement, it helps kind of cover the out-of-pocket costs left over from original Medicare. So you don't usually see a bill, but you have a higher monthly premium with the supplement side. It doesn't necessarily have the network restrictions. So I like to make the joke that if you've got grandbabies in California, Colorado, and Texas, you need a plan that works well with a lot of different networks.
That makes a lot of sense. Wow.
It's a very individual conversation, even between couples. You may not end up on the same plan.
Now, we've been talking about you review your Medicare coverage every year. Should he do it more than that, or is this just the time because it's annual enrollment, right?
It depends on what you've got going on health-wise. If you've got concerns and something coming up and you want to review it, we can absolutely review it and kind of estimate costs or co-pays based on what your plan says. However, once a year is the only time they can make changes to your plan. So it's good to review it at least once a year, just to know what your changes are in the next year.
How about mistakes? Again, a lot of fear and loathing about this. What are some of the biggest mistakes, Sadie, that you see?
People that haven't had a review and things have changed. If they've gone from, and I think I used it last time, the example of my mom, somebody that has been always very, very healthy, all of a sudden has to have a stint, has to have different things. And she left the hospital with, I think, five or seven medications from zero.
Wow.
So that completely changes the whole ball game of what's going on. And you may have signed up for your Medicare being a healthy person, and this is, I don't need anything. I don't need to worry about that. I don't go to the doctors a whole lot, only, my once a year physical type stuff. And now all of a sudden you've got heart doctors and you've got all these different things that you need. So it's just making sure as we age, and as things change with us, that we're making sure that we do that. The good thing is even if you're with somebody, have somebody else check out your stuff. Make sure that it's what's needed. Family members with older parents, double check. Go to those appointments with them, because sometimes they don't understand. And I think we talked about it last time. Some of those extra things that they throw in, they do, groceries and different things. And that's great if that's where you want to go. But we want to make sure that people understand that they know that those can take away from other.
They put groceries on the Medicare supplement, the Medigap or whatever.
Not the Medigap side of it, the Advantage side of it. You can see sometimes healthy foods for those that qualify.
Okay.
It's a chronic condition that usually you can
Gotcha.
qualify for that one with. And then some carriers on some plans do have what they call over-the-counter cards. To where they can buy different things over the counter, vitamins, supplements, toothpaste, toothbrushes.
It's very interesting. I mean, you just don't think of insurance getting involved in that kind of
correct.
stuff.
And we want to
right?
make sure that somebody that may need a hospital, that they, being admitted into the hospital is a main concern for themselves and their family. That's what they're focused on, not, some of the other things. So we want to make sure that everybody, if you're helping out your mom and dad with their stuff, that everybody understands. So then if they get admitted, that things are covered correctly and that we're on the right track.
All right, 2026. You're turning 65 in 2026. What should you be looking out for? What are some of your key dates there?
Knowing when your birthday is, so you have obviously you would know that, but your birth month. So you have your birth months 3 months before and 3 months after to figure out your Medicare and what you'd like to do with it. So are you still working, or can you put that off getting your Part B and delay getting Medicare and stay?
So you have
on
to
your employer
sign
coverage?
up for it, but you might, if you're still working, you just keep going with your
Part of
employer
it.
more than
Correct.
likely. Yeah.
You have your Part A. You could delay getting that. Sometimes they give it to you. That doesn't. It's kind of a wash there whether or not they do or not, because you don't pay for it and you won't be using it until you get Part B. Part B is the one that you technically pay for, and that's the one that really signs you up for Medicare.
Interesting. We are talking to Sadie and Emily from Hilling-Pfeffer Insurance. It is Medicare Annual Enrollment, but I really want to pivot here to Penny. Penny is the Pennsylvania, what would you call it? It's kind
Open
of
marketplace.
open marketplace. It's kind of Obamacare for PA, right? So, all right. So for people that don't qualify for Medicare yet, but they need a plan, tell us what Penny does there,
Okay, the Penny will take anybody that is under the age of 65, and we can, so under
65.
so before you qualify for the Medicare, that is where you can go. So if you are self-employed, if you are part-time at your job and you don't have any health insurance offered to you, that's when you can go onto the Penny, which is the marketplace, and we also help people with that as well. You can go on, and some people that may not qualify for Medicaid anymore, because let's say that they did get that part-time job and they're doing some things, this is where they would go. And there's still subsidies out there to be able to, for lower income. We're able to do that. Those automatically populate in there. So we take a little bit of information, put that into the system, and then it turns around and gives us, if you do receive any tax credits or subsidies, those are in there. And then we kind of go from there. And you'd be surprised what people can still qualify for. Please reach out. There's a lot of different things that are available for them.
So we can come to you and agents like you for Penny, as opposed to kind of being out there on the computer yourself, right?
Absolutely.
You can
That's
absolutely
the
do it
key.
on the computer, but we train in this knowledge.
Yeah.
So when you start playing in co-payment, co-insurance, deductible, out-of-pocket maximums, I feel like we're back in middle school memorizing all those definitions.
EPO,
So,
PPO,
yeah, HMO, POS.
There's a lot of different things. I just had a phone call before we came down. Somebody had the wrong plan for being in like the Meadville area.
Okay.
Because there's multiple hospitals. We have to make sure
You have to make sure you're in network,
the
right?
doctor was in network, the hospital was not.
Oh my
so it's one
gosh.
of those that his EPO plan didn't work. He needed to switch to a PPO plan. So in 2026, that's what we're looking at. So it's going over, comparing the plans, finding out, your deductibles, your maximum out of pockets, explaining that to people. It can be a lot. But it's what we do, every day.
Yeah.
So for us, it's second nature. And that's why you want to have somebody that understands and can help you. So if you're in a different area, that you're getting the correct answer.
So the way to think of Penny is Medicaid is for low income people that qualify.
Mm-hmm.
Penny is in the middle. If again, unless you have your own group insurance from your employer,
Correct.
and then as you get older, Medicare kicks in at 65.
Yes.
Yeah, boy, they should have. They just changed 3 letters, right? Anyway, so talk about some people think that they make too much for like Penny. That's not the case, right? If they don't have another group
Correct.
insurance, they can shop on the marketplace.
Absolutely. But
So
you just
tell,
don't get
how do you navigate that, Emily? What does that process look like? I mean, again, you have to get some data and then you plug it in, right? I mean,
So there's an application process, which you can start on your own if you would like to through the Penny, or we can sit and do it with you. And we answer all of the questions in there: who's in the household, who's seeking coverage, whether it's everybody in the household or maybe only one, and kind of go from there. And Penny tells us exactly what you qualify for. Sometimes it takes a little bit of time and some other documents to verify, but generally it's pretty quick. And especially if you've already are in the system, we just go verify your information from last year, double check it, make any changes we need to, and then it'll tell us again what your tax credits are, if they're applicable. If you're not, we go look at plans. It's going to tell us pricing right in there and give us all the options available to you according to your zip code.
all right, it's November 12th. What's our dates look like here for, what is it, open enrollment for Penny, right? So is it almost over, or is it over?
Close. It's not over yet.
Okay,
No.
good.
Oh, no. We've still got much
got some
longer
time,
this
yeah.
season. So if you would like your insurance to be effective for 1/1, December 15th is your deadline.
We have a month.
2/1 effective, your deadline is January 15th. But don't delay it to January. Why need 2/1 when you can get a 1/1, which is better.
Sure, yeah. And most people have cover. If you already have coverage, you have it through 12/31, right? Generally.
Correct.
Okay.
And then if you don't make any changes to it, it will roll over for you. But it's good to double check it, much like Medicare every year, just to know what those changes are. Sometimes they're minor, plan to plan, but we can pull up both years and tell you exactly what those changes are.
Let's talk about Hilling-Pfeffer Insurance, and again, what you two and the whole team offer here. Local options, looking at it all here. Just again, talk about what your approach and your philosophy to serve.
We're very much local people, and we don't realize what an asset that is. I had a call last week into a carrier, was trying to check if a hospital was going to be a network, couldn't figure out how to do it online, had to call in. And the woman said to me, well, it's your local hospital. And I said, ma'am, I'm from Erie, Pennsylvania, where 2 hospitals are owned by 2 insurance companies, or vice versa, whatever it is.
Right.
So very easily, either one of those could be our local hospital. I need you to tell me which one it is. And so finally she could answer the question, but we're in a very unique situation in Erie, Pennsylvania.
Absolutely.
And you want to throw in LECOM into it, technically we have 3.
Right.
Yeah.
I would imagine that any one of those hospital systems, and that includes the docs that work for the hospitals, they may or may not be on a particular plan, right?
Correct. It
depends on what carriers they represent. And it seems more and more unique to each doctor, not necessarily their facility, which is a good thing.
Oh, you mean you could be in a group and have different docs take different plans?
Slight variations, yes. They generally take about all the same.
They're really making it hard on us a little bit, huh?
It's actually a good thing.
Okay.
So we need to be aware of networks, but that means if you, for example, are on a UPMC plan, you could maybe see a doctor from St. Vincent. We know there's crossover in the specialties.
Okay.
We know sometimes only St. Vincent has one specialty or is known to be better at one specialty than Hammett, or vice versa. It's very unique.
when you talk to the folks that are knocking on 65 or maybe even 70, they're already in this. Do you ask them to start looking for particular specialists that, hey, you might need an ortho. You might need, even though they,
You'd be surprised how many already have those things in place and have
they do.
in again, being, local Erie people ourselves, we all have our hospital of choice,
Sure.
which is very interesting because I could ask you which one you prefer to go to.
Right.
And then, and we all have our place that we like to go to. So a lot of people by 65, 70 years old are kind of set in their ways on where they like to go. Some, then I have another that says they don't really care, and as long as they can see them, and it's very
They'll
interesting.
switch the doctors as much as they want.
Right.
I know that I'm not 65 yet, but I also have my preferred place that I like to go. I have my preferred network that I deal with. Those types of specialists are pretty much already set.
Okay.
By that time, for the most part, it's where we're located. It is pretty much between the two. If we start going out further into, Crawford County, things like that, we do add some other ones in there that we have to be mindful of, especially with Penny, with who they're seeing, what we're doing.
Okay, people are yelling at the radio saying, well, how do I get a hold of Sadie and Emily here? So the number is 814-455-7611, right?
Yes.
455-7611. Website and all that stuff.
Our website is hilling-pefferinsurance.com. Pfeffer is like pepper with F's, though.
Instead of the P's, the F's. I like that.
It's an easy way to do that one. And then we are located up on State Street, not too far from the news station.
Okay. That's right there on, what is that, 34th, 35th, and State.
Yeah.
3405 State Street.
Yes.
Terrific. And again, you take the phone call, you make the appointment, willing to kind of lay the land out, right?
Absolutely. I mean, being local people, we want to make sure that we're helping as many people, in Erie County and the surrounding areas as that we possibly can. That's what we're here for. So whether it be your Medicare penny, supplementals that we don't talk about,
right?
There's a lot of different things that Emily and I do in the healthcare division, and we're adding people to our team. So it's really, we're growing, and we're very excited for what we can do for for Erie County and beyond.
And again, with that December 15th deadline looming
For Penny.
but it's not too late to just check in with you guys and get a review.
No, absolutely
and
not.
it's free, right? The free review for
Yes.
sure.
Free reviews for both Medicare and for Penny. We'll gladly get you set up and take a look at what you have going on and make sure that you have the right plans.
Sadie, Emily, Pfeffer Insurance Agency, the healthcare side of things, 814-455-7611. Thank you, ladies.
It's been a pleasure.
I always enjoy our conversations here. Stay with us. More ahead on Talk Erie.